Hi, my name is Raymond Henley. I'm the Director of Specialty Clinics for UNC Health Southeastern. I'm also a patient of the Digestive Health Clinic, and I'm here to tell you a little bit about the colorectal month that we're celebrating the month of March. We're excited, we're very concerned also about really getting this information out. And I want to tell you about my story. My first colonoscopy was done when I was 30 years old, and I know that's super early. But the problem is my father had colon cancer, my grandmother, my mom's side had colon cancer, and so I knew, and my wife knew, that I was highly susceptible to get colon cancer. And so she really encouraged me to go forth. Hey, I'm working at this wonderful health facility. Why not go ahead and get your colonoscopy done? So I did that, and I'm glad that I did. They were able to find some precancerous polyps that were easily removed, and I've been great ever since. I come back every 2 to 3 years for a great follow-up. I recently had one 2 weeks ago with Dr. Andrews. I had a wonderful experience. I'm clear, and now I have to come back in 5 years. So this whole entire month, we really encourage you to tap into your resources, talk with your primary care provider, talk with with Dr. Andrews here at the Digestive Health Clinic, schedule your appointment. There are a lot of different ways that you can be screened. Everything does not have to mean that you need a colonoscopy. It could be a Cologuard test. It could be something as simple as in the office. So just take the time, be concerned about yourself, and get checked out this month.
Hi, my name's Allan Hiroshi Andrews. I'm a board-certified gastroenterologist. I work at UNC Health Southeastern, Digestive Health Specialty, and I've been here for a year now. I've been a practicing gastroenterologist for 15 years. I started in the United States military in the Army as an active duty physician and gastroenterologist. So every March, gastroenterologists are a little bit excited because everyone's familiar with the pink ribbon, but we're proud of the blue ribbon. The blue ribbon is symbolic of Colorectal Cancer Awareness Month. Colorectal cancer screening has traditionally been something that begins for average risk individuals, meaning adults between the ages of 50 and 75 with no strong risk factors for colon cancer. And what we mean by that is no family history, that is mom, dad, or brothers or sisters who have had colon cancer, or personal history of having colon polyps. If an individual doesn't have any family history of cancer or personal history of colon polyps, then he or she traditionally would be invited to either have a colonoscopy beginning at age 50, or what we call a FIT test. That's the stool-based test, which is called fecal immunochemical testing. For patients who are appropriate candidates for colon cancer screening, typically they would be identified through their annual wellness visit with their primary doctor, be it family practice, internal medicine, or GYN provider. If someone is so healthy that they actually don't go to the doctor, or maybe they're not so healthy and don't go to the doctor, we would encourage them to go through a primary care provider and then obtain a referral to us at UNC Health Southeastern Digestive. And we would be happy to see you in our office and schedule a colon cancer screening test, either a colonoscopy or a FIT test. So it's certainly understandable during the last year, this has been an unprecedented time and people are fearful for their safety being out in public or a grocery store, much less being in a hospital or healthcare environment where they might be exposed to the coronavirus. The risks of being exposed to COVID are very small and are certainly justified if the patient does require appropriate cancer screening, for instance, in this case, a colonoscopy. The anxiety is understandable for trying to delay as long as possible seeing your doctor or having a screening colonoscopy or other cancer screening tests. Certainly though, we do encourage you as soon as possible to come on in and get the test done, because the risks of delaying cancer screening can be unfortunate. Ultimately, what we say in the medical profession and in my line of business, gastroenterology in particular, is that it doesn't matter what test you get done as long as you get a screening test done. In other words, the most important screening test is the one that you choose, the one that you're comfortable with doing, and that you get it done. So again, the two options are either a fecal-based test, but I am biased as a gastroenterologist. The colonoscopy is not only a screening test, but it is a prevention test. And specifically what I mean by that is if we, during the test, find small polyps, which are abnormal growths that may turn into cancer in the future, we can safely remove those painlessly while you're asleep And in that way, we break the chain between precancer and cancer. So again, it's important to get whatever test you feel is best for you and your family doctor recommends for you. But I do recommend consideration of a colonoscopy.